Yep, that's me. You're probably wondering how I ended up in this situation.
A few moments later.
How did I get there? That was a reel that I posted on my Instagram and my TikTok about a little bit of what's going on with me. And there's been a lot of questions and a lot of concern, a lot of love and support and well wishes, as well as a lot of, girl, I'm right there with you. I'm going through that too, or something similar. So we're going to get into how I got there in that reel. And I'm assuming many of you possibly landed here on this video because you did maybe a search for fibroids or ovarian mass. Maybe you did a search for myomectomy, hysterectomy. Maybe you did a search for adenomyosis, or maybe even CA125, and this video has popped up. And so with that, I say welcome. All of those things are a part of my life currently. Some I've been dealing with for a while, pretty long time, and some of it is very new to me, which has created a scary space to be in currently. But let's get into it. Let's do a little bit of a story time, as well as a little bit about me and what's going on with me. This is my very first YouTube video. This is not how I wanted to start my YouTube career, but here we are. So let's go. And I decided to vlog this journey because, like I said, I've been in a very scary, emotional space over the last month, as I've been going through a lot of doctor's visits and testing and everything. And it all culminated last week with a visit to gynecology oncology. And I need an outlet. And I can be somewhat isolating and I can withdraw. And if I don't get in front of this and doing something to help me release everything that's in my head, everything that I am feeling, all of these emotions, help to regulate all of that, then it will probably send me into deep, dark depression. And that's something that I don't want to deal with, or that's not a path that I want to go down. So I decided, let's vlog this in hopes of not only helping myself through this process and this journey, but hopefully also helping someone else, because I have a lot of information. I am a nurse practitioner, so I know a lot, or I know more than I would say the average person about health-related things. But I know that when you're going through something like this, you can feel like you are the only person in the world who is dealing with this. You're not. Logically, I'm sure you realize that you're not. I know that I'm not, even though I have those same feelings as well. So hopefully, as I share, I can educate, I can inform, and I can inspire others to advocate for themselves, as well as just a reminder that you are not alone in this journey. There are lots of women who are walking this path with you. So let's get into it. A little bit about me. My name is Shamaya. I am 45. I will be 46 next month. I am a March Pisces. And I am single. I do not have any children. And I am having some challenges right now related to my gynecologic and reproductive health. Now, I'm not new to fibroids. I have been dealing with fibroids for about 13 plus years now. I had my first myomectomy in 2013. I had my second myomectomy in 2019. And now here we are, 2025, and my fibroids are back, along with some friends. They're like, hey, we're here, girl. No, this wasn't on your bingo 2025 card, but we're here, so get ready. So just a quick little history of kind of what has led me to this point in terms of symptoms and all of that. So back in 2019, when it was determined that my fibroids had come back and I needed a second myomectomy, I had that second myomectomy in April. It was a month after I turned 40. I had just gone on this fabulous 2-week solo trip to Thailand for my birthday. And I was coming back from that trip preparing to have my second myomectomy. Prior to, though, having the surgery, my gynecologist, who had been with me since I was about 26, so she'd been with me through all of this. She did my first myomectomy and everything. She had a talk with me, and she was like, what do you plan on doing in terms of having children? Do you want to have children? Is that something that you want to do in terms of like having my own children, birthing my own children, trying to get pregnant? Because she was like, if that is something that you do want to do for yourself, you need to make this a priority now. She's like, you're 40, your fibroids are back, and more than likely, they're probably going to come back and you're going to deal with this again. So she's like, once we do this second surgery, you really need to make a decision on what you want to do. And if you do want to try and have children, I highly encourage you, Shamaya, to like make it a priority and start working towards that, whether that's trying to get pregnant on your own naturally. And if that doesn't work, starting with IVF, or she's like, if you want to go and start IVF off rip, she's like, do that. But she's like, you need to do this if this is what you want. And at that time, I was on the tail end of a very toxic and codependent relationship. I had gained a lot of weight over the course of 10 years. I was not happy with myself. I didn't like the way that I looked. I was just in a very dark, miserable place. And I'm like, I need to focus on trying to get myself together. I need to lose this weight. I need to get out of this relationship. And I was like, I can't bring a child into this situation. So I was like, I understood what she was saying, and I appreciated her being very frank with me about that. But I was like, I'm not there. So 2020 comes around, and it's the COVID, it's pandemic. And so I was working a lot during COVID. And towards the end of 2020, I was like, I really need to lose this weight. I have allowed it to prevent me from living life, from participating in life. And I need to make it a focus. So I made some changes, I made some decisions, and I got on this journey to lose this weight. And by May of 2021, I had lost 75 pounds. And so I was 200, and I'm 5'2" and a half, and I'm short. I always say I'm fun size, but I'm short. So 200 pounds was a lot for my height, for my stature. And although I didn't have any health issues other than the fibroids, and I have a herniated disc in my lumbar, and sometimes I have sciatica flares. Other than that, I was relatively healthy. But I know the trajectory of obesity, and I didn't want to go down that road. So I lost the weight. I lost 75 pounds. I got into my 120s. Had not been in my 120s since high school, going into college. Like the 99 to the 2000s. That was the last time I had been in my 120s. But got down and have maintained the weight ever since. I was feeling good. I loved the way that I was looking. I love clothes and fashion. And so I got best dressed in high school. And so clothing has always been a part of fashion, always been a part of my life. So I am shopping, I am dressing the way I want to dress again. I am feeling good. My confidence is up. You know what? Start dating. You hadn't dated in so long because you'd been in this situation, this relationship several years too long. So I'm like, I'm going to start dating again. I start doing the online thing, and I'm just like, I'm feeling better. I'm happy. And I'm like, oh, it's going to happen. And I'm like, Dr. Lansdowne, she was worried about nothing. I'm like, I'm just going to be an older mom, but now I'm putting myself out there. I'm going to meet someone. We're going to fall in love, and I'm going to get married. And I'm going to have my babies, and everything will be just fine. This is the way it's supposed to happen. We'll be fine. Little did I know that doesn't always work like that. So I was dating, but didn't really meet anyone where it was serious at that time or whatnot. And so time continues to roll on, because that's what time does. It waits for no one. And so now we're in 2022. And my gynecologist, she's like, let's do some fertility testing. Let's just see where your numbers are, because if you're thinking about this, let's make sure that there's no concerns, or if we have to do any procedures or surgeries or whatnot. And so she ran all of these fertility blood tests. She tested my LH, my FSH, I think my AMH. I had an HSG procedure done where they insert dye into your fallopian tubes to make sure that there's no blockage and your tubes are open and everything. So she did all of that. Everything came back normal. My levels were good. My egg reserves were good for my age. My fallopian tubes were nice and open. Everything was fine. And she's like, numbers look good. You're in a good place. There's nothing concerning. She's like, so let's make a decision. Let's move. Let's do something. And by then I was still dating, meeting new people, but I had really started to consider doing IVF and using donor sperm. And I was going down that path because even though I'm dating, I don't want to walk into a new situation, meeting someone like, hey, I'm Shamaya, nice to meet you. And by the way, I really want to try and have a baby by next year or within the next 2 years. I didn't want to meet someone new and go into a situation with that much pressure on myself, on him, on this situation. I'm just like, that's just too much. So I was like, really maybe consider using a donor. And so I had found a fertility practice. I had signed up with them. I signed up with a bank and started to go through profiles. I'm looking at pictures. I'm reading their history, their pedigree, where they come from, careers and school and all of this. And so I'm really giving this a lot of thought. But that's as far as I went. I didn't go further than that. And I don't know why. I think maybe something in me was like, maybe it'll still happen organically. You'll meet someone and maybe they'll want the same thing and this will all happen as it's supposed to happen. So that kind of is where I stopped at, or as far as I went with the IVF and the donor. So now we're in 2023, right? And now my period has changed. My period is now heavy. It's not significantly heavy, but it's heavier than it had been in recent years. And now I'm having some pain and like discomfort. And so I call my gynecologist up because again, we have a great relationship and I let her know what's going on with me. And my period, my flow is heavier and I'm having a little bit of pain. I'm just a little concerned. And she's like, let's just do an MRI. I'm used to getting probably mostly transvaginal ultrasounds, but she's like, let's just go ahead. Let's not even do a transvaginal. Let's just do an MRI and let's repeat your fertility tests, your numbers. I didn't have the procedure where they do the fallopian tubes, but I had all of the blood work done again, and I went in to do my MRI. So I get the results back. My MRI, of course, shows an enlarged uterus and my fibroids are back, right? On top of that, my numbers have dropped. Everything is lower from when she did the test the year prior. Not significantly lower, but they dropped. My egg reserve has dropped. Everything has dropped. And she's like, you need another myomectomy. And that was the last thing that I wanted to hear because I didn't want to have another myomectomy. That would be number 3. There's scar tissue, even though they've been performed laparoscopically. I don't want to have another surgery. And she's like, listen, because your numbers are lower, because the fibroids are back and where they're located, she's like, they're going to impact your fertility. They're going to make it very, very difficult for you to get pregnant on top of your numbers being on the low side. She's like, you need IVF, but you don't want to do IVF and you don't have a clean slate essentially down there. She's like, you need to get these fibroids removed before you start IVF. And I just sat on it. I didn't make a decision. I don't know, subconsciously, maybe I was just like, if I don't think about it, it'll go away. And I think I do that with not a lot of things, but some things in my life. I like, rather than facing them head on, I just kind of retreat and deal with it later. And that's what happened. I didn't move on having the myomectomy. The third myomectomy, I didn't move on having IVF started, and things just continued. Now we're in 2024, and now my period is bad. My flow is significantly heavy, so heavy, to the fact that I don't leave my home the first 2 days of my period, especially day 2. It is just like bad. And I don't want to be graphic, but I use a menstrual cup, and I own several menstrual cups, and I probably have one of the largest, if not the largest cup on the market. It holds like 65, 70 mLs. And on day 2 of my cycle, I am changing that cup every hour. That's how much I'm bleeding. I don't want to leave the house because I'm afraid that I'm going to just bleed through everything, and it's painful. It's so painful. But on top of that, now I'm also having severe abdominal and pelvic pain. And this is different than the pain that I've experienced before. This is even different than what I had experienced with my previous fibroids. Previously, I would have discomfort with my fibroids. There would be an ache and a dull ache here and there, but it wasn't painful. Now I am in so much pain that it brings me to tears sometimes. And this is outside of my period. This is just a regular day, and I am just in pain. And the pain is most severe and isolated in my left lower side. It feels like something is pushing against my pelvic bone on the lower left side. And I'm like, is it in my bone? Because I'm like, do I have disease in my bone? Because sometimes it feels like it's the bone. It can be so bad that it causes me to limp sometimes. I'm taking Tylenol. Tylenol is not doing a damn thing. I can't take NSAIDs. So I don't take ibuprofen or Aleve or anything like that. So I'm just trying to push through the pain, but it's getting worse and worse and worse. On top of that, my bowel movements have changed. I'm dealing with these changes in my bowel habits. And I'm like, this is not normal for me, because my diet has been the same since I lost my weight. And a big part of me maintaining my weight loss is that I eat the same thing over and over again. I have become a creature of habit. So my diet has not changed. So I'm like, why am I dealing with these bowel issues? Because I'm not eating anything new. Sometimes food doesn't stay on my stomach, and I'm just like, what is going on? I'm like, maybe this is why I had been going through some hair loss and thinning, things like that. I'm like, maybe I'm malnutrition because I'm not digesting food, because it's not staying on my stomach. So on top of all of that, I'm also having a lot of bloating. And again, my diet hasn't changed. And so I'm not sure why I'm having this bloating, but the bloating gets so bad to the point where, going back to my weight loss, when I was close to hitting my goal weight, I got waist beads, and I had 6 waist beads placed on, and I had them put like right across my belly button. So they fit at like my natural waistline, but I ended up losing more weight. I ended up losing maybe another 10 to 12 pounds. So they dropped, and they had just been sitting at my hip. And I never went in to have them like retighten, because I was okay with them just sitting there like at my hip area. And they have been there for the last 2 to 3 years. Now all of a sudden I'm doing this all day long. I'm trying to loosen my waist beads, and I'm like, why is this so tight and uncomfortable? And it's like, because I'm bloated all the time. And I'm like, again, this is not right. This is not normal. This is not what I had been experiencing previously. It got so bad to probably 2 months ago, I went into my bathroom and I cut my waist beads off. And I had them for like the last 3.5 years. And I just cut them off because I was so sick of them being tight and digging into my skin. So my periods are bad, heavy, so heavy and painful. I'm having abdominal and pelvic pain outside of my period that is really, really, really bad, that it brings me to tears. Sometimes I don't get out of the bed. I'm having bowel changes. That's new to me. I'm having bloating. That's new to me. Oh, and on top of it, all of that, I've been anemic. I've been suffering from, anemia. And it hasn't been to the point where I had to get like a transfusion or anything, but I take iron pills every day, and my hemoglobin stays at a 9. It never goes beyond a 9. And that's just because probably my flow, and also if there's anything else going on in my body that is like sucking blood from me. So I'm going through all of this. I'm like, I need to get this checked out because it's progressing, and it's not getting better. It's getting worse. And by then I have a new job. I started a new job in June of 2024. And with that came new health insurance. And so I had previously been with Kaiser for the longest in terms of my health insurance. Like as an undergrad, I had Kaiser. And then when I started working as a young professional, I'd always selected Kaiser with my employer. When I decided to become a nurse, I was a new grad RN with Kaiser. So I'd been with Kaiser for a very, very long time, and I liked Kaiser. I loved my PCP. He was awesome. I loved my gynecologist. Kaiser had been good to me. It was very easy for me to navigate. And so now I'm at this new job and they don't offer Kaiser. Now I have to find all new providers. And I kind of need to do this fast because like I suffering, you know. I do a search, I find a provider, and I make an appointment to go in to have a physical and to establish care. And she's great. She is very thorough. She is getting all of my background history. She is going to run a full panel of labs. She's asking me, she's like, is there anything you want me to run? And I'm like, well, maybe we can check my hormones, run a cortisol. She's like, yeah, whatever you want me to run, we'll check. I let her know about like the bloating and everything. And she's like, oh, she's like, let's get you over to GI, so have them check you out. She's like, you're 45, you need a colonoscopy anyway. So we're just going to have you go over to GI. And then she asked me, when was the last time I had a pap smear? I said, probably about 3 years ago. And she's like, okay, well, a pap smear today. So we do the physical. And then at the end, we do the pap smear. And so when she puts the, the speculum in, she has a hard time seeing my cervix. And that's not concerning for me necessarily because my uterus is tilted, it's retroverted, so it sits back. So it's always been very difficult for my gynecologist to visualize my cervix. There has to be some kind of maneuvering going on to see it because of the way that my uterus is positioned. So that wasn't concerning. Then she goes in, fill on my ovaries or whatnot, and she goes in, she's like, oh, and I forget the term or the phrase that she used, but basically she was like, everything is compacted in there. She's like, yeah, you need to be seen by gynecology. And she's like, I'm going to order a transvaginal ultrasound just to get that out the way. But she's like, I want you to be seen by gynecology. She also orders a mammogram because I'm due for a mammogram. So I go in to have my mammogram and my transvaginal ultrasound. And then maybe 2 weeks later, I'm seen by a GI. And I go in to see GI and I let her know, let her know what's been going on with me, about my bowel changes and the bloating. And she's like, yeah, I'll do a colonoscopy. That's not an issue. But she's like, let's do some testing. She orders this like massive stool test where I had to give them all this stool. It was a lot. And she's like, we'll check you for celiac disease. We'll check you for allergies and everything like that. She's also like, let's do a CT with contrast just to, before we do the colonoscopy, just to, if anything's going on. Again, an awesome provider. And I feel like I've been so lucky because I didn't have to go in and advocate for myself. I did not have to press the issue. I wasn't dismissed. Everyone, my PCP, the GI specialist, they're like, oh, well, let's do this, let's do that, let's run these tests, like what you're supposed to do when a patient is having concerns, and not be like, oh, it's probably just this, or oh, don't worry about that. No, like run diagnostics when they're warranted. I have the CT with contrast done. By then, my PCP office calls me because she wants me to come in for a follow-up because she wants to go over all of my labs and my test results and everything, the ultrasound, the mammogram and everything. So I go in and I see her. She's like, the transvaginal ultrasound, your uterus is really, really enlarged and your fibroids are really significant. You have a lot of fibroids. But they couldn't visualize my left ovary. And so that was a little concerning, but by then I had already had the CT with contrast that was ordered by GI, and she had a copy of that report. So she goes over that report with me. again, my uterus is really enlarged. There are multiple fibroids and what look like benign tumors. But on the left side, adjacent to my left ovary, is something that they can't really make out. They can't tell if it's a pedunculated fibroid or an ovarian adnexal mass. And so on the report, it's like to have an MRI with contrast. And so my PCP orders the MRI with contrast, and then she's like, let's do a CA 125. Now, it is not the best like screening for ovarian cancer because it can be elevated for other reasons, not just ovarian cancer. It can be elevated in endometriosis. It can be elevated when there's some inflammation going on. But she's like, I want to get one out of the way. She's like, because it's in so much pain. A lot of it is on the left side. Now this report is showing that there is something that they can't really determine on the left side where you've been having all this pain. She's like, let's do a CA 125 and get that out the way. So that was on a Friday that I saw her. I went in on Saturday to LabCorp to have the CA 125 drawn. On Monday, I get my MRI with contrast scheduled. And then with LabCorp, of course, your results as a patient, they'll email them to you. So Monday night, I got an email from LabCorp saying that you have test results in, new lab test results in. So I log into my account and I know it's for the CA 125. And sure enough, it's elevated. And I think it's supposed to be between 0 and 38. That's normal. Mine was at a 91. And so, elevated. And so I try to not freak out because, again, I'm a nurse practitioner. I understand that there are other reasons that can cause this to be out of range. And so the next morning, I have a missed call from my PCP, and I know she's probably calling me because she got my CA 125 results in as well. And so I call her back, and she's like, hey, the result for the CA 125 came in. I'm like, yeah. And she's like, so elevated. I'm like, yes. And she's like, so now you're going to see gynecology oncology, not regular gynecology, which I knew is where I was headed with all of this. And with the CA 125, I knew I need to see gyn onc. And she's like, when is your MRI with contrast scheduled? And I'm like, it's not for like 3. And she's like, oh, no. She's like, you need to have that done like next, because within these 3 weeks, I want you to be in with gyn onc. And she's like, they're going to need that MRI with contrast. So it's better for you to have it done prior to you seeing them. So we get it moved up for the following Monday. Now, I'm a nurse practitioner, but I do not have a Rolodex of like physician list, turn to. I do not know any gynecologists, oncologists. And again, new insurance. So I have to find someone. I do a search and I'm trying to find someone who seems to be very experienced. And, this gynecologist, oncologist, he's with a practice that's pretty well known and they're good. He has good reviews, and they specialize in reproductive health and gynecologic cancers and everything. I'm just hoping I can get in to see him because he's pretty popular. So I'm able to get an appointment. I let them know everything, that what's going on with me and all of that. And so I get an appointment. I have my MRI with contrast, and then I get a copy emailed to me from the center of my report the next day. So I'm reading the report. And again, with my CT and also with this MRI, all of my abdominal organs are fine. My liver's good. My pancreas is good. Kidneys are good. Bowel, intestines, everything is good. Okay. It's reproductive organs that are in freaking shambles. So I get the MRI report. It is reading, the same. And so again, my uterus is enlarged and it's retroflex. I don't do radiology, so I can make out some of this, but some of this is new terminology to me. They're saying there's multiple T2 hyperintensive implants in this area. There is, measures this centimeter. It's no visible elevated T1 signal. I don't know what any of this means. So what do? I head to Reddit. I'm reading radiology reports and whatnot because I need to know what all of this means, essentially, tumors, very consistent with a multifibroid uterus, but also with the presence of severe adenomyosis. That's new to me. I had never been diagnosed with endometriosis. I had never been diagnosed with adenomyosis. And now I'm looking at this MRI and it's saying I have severe adenomyosis. And adenomyosis is like the cousin or the sister to endometriosis. So with endometriosis, you have all of this tissue and cells that grow outside of the uterus. It grows like within the cavity of the uterus, and it causes a lot of pain for women. It can cause very painful and heavy periods. And so with endometriosis, it can usually be managed and treated with hormones and then going in surgically to remove the overgrowth, the tissue, because it's not within the uterus, it's outside of the uterus. And so it can be treated that way. Now, that tissue, that growth will usually come back because that's just usually how endometriosis works, unfortunately, which is why many women who suffer from endometriosis, especially like at stage 3 and stage 4, they end up getting a hysterectomy because it's just this cycle. With adenomyosis, however, that tissue grows within the walls of the uterus. So it's not outside, it's attached to the uterus, to the endometrium of the lining of the uterus, and it adheres there. And so you can't go in and cut it off. You can't cut off tissue that is within the uterus or attached to the uterus. The only way to treat adenomyosis, it's not with an IUD or hormones, it's really with removing the uterus, because that's where the overgrowth of the tissue is. And it is so painful. It causes so much pain. And now I am looking at this report and it's saying that I have severe adenomyosis. And I'm like, oh my God, like I'm not expecting this. And I'm like, is that what's been causing this pain that I'm having? Because it's so bad. So I finally get in to see gynecology oncology, which was last week. He walks in the room. He's very nice. He sits down, introduces himself, and like, reading all of your reports from everything over the last month. I've looked at your imaging, and he's like, especially the one near the left ovary, the mass doesn't appear to be cancerous. It looks benign. So that's the good thing. He's like, but of course, we won't know until we get in there, take everything that needs to come out, and send to pathology. He's like, also, your fibroids are really bad, and you have a lot of them in varying sizes. And he's like, those need to be removed as well. And then he was like, now you have also stage 4 adenomyosis. And in the MRI, they didn't stage it. They just said severe. But now the gynecologist oncologist is saying that it's at stage 4. And stage 4 is the highest like level of stage of it. And so he's like, you're going through now what I'm looking at. He's like, my recommendation is a hysterectomy. And I knew that was going to be the recommendation because, again, I'm dealing with this. I am suffering through this pain. I am reading all of these reports from the CT and the MRI. I'm doing my own research. So I knew that was going to be the recommendation. I didn't want that to be the recommendation, but I knew that probably was going to be the recommendation. He then goes on to say, I understand you do not have children. And if you want to still try to have a baby, he's like, we need to go in, remove all of the fibroids, remove all of the tumors and the masses. And he's like, as soon as you heal, he's like, you need to do IVF. He says, I am 2,000% sure that you will not be able to get pregnant without IVF. He's like, there's no way. He's like, and you have stage 4 adenomyosis. And then he goes on, he's like, and the adenomyosis, you're going to continue to have the pain. You're going to continue to likely have the severe heavy bleeding because we can't go in and remove the overgrowth of the tissue. The only thing we can do is remove your uterus. And that's how we would treat that. So he's like, I understand that that's a lot for you to think about, a lot to decide. He's like, if I thought that this was cancerous and that there was some malignancy involved, he was like, we would be having a very different conversation. But he's like, as a gynecologist, oncologist, I do this every single day. I see women like you every single day with what you're dealing with. He's like, but of course you have to make the decision that is best for you. So that was last week, and it's been a hellish week of emotions and yeah, lots. Trying to decide on what it is that I should do and want to do. And ultimately, my health comes first. And also, I am so sick and tired of suffering. I am like sick and tired of this pain. I'm tired. I have pain all the time. It's in my leg. It's bad. But lot. I've gone through just a number of different emotions. There's been sadness, there's been anger, there's been disappointment, there has been regret, there has been everything that you can think of. I've been experiencing it, and it comes and goes. And I didn't think that I would be faced with having to make this decision. I wanted to have kids of my own. It was always something that I thought was automatically going to happen for me. Like, I'll say when I hit 43, I started to grieve a little bit because it hadn't happened for me yet. And so I was like, is this ever going to happen? And I realized my age, and I'm like, this may not happen, but there was still like hope and maybe and the possibility, because although it hadn't happened, it could still happen. I was holding on to that. But with a hysterectomy, that hope and that maybe and that possibility is no longer, because you can't, when you have a hysterectomy, you can't birth your own children. I can still be a mother, of course. There's plenty of ways that I could still be a mother, but having my own children, that goes away with the hysterectomy. And so that's been tough, because that grief with that is very different. It's heavy. And I think I started to experience a little bit of that when I left the oncologist office last week. And so that's my story, and I'm sticking to it. And again, I decided to vlog this because I have felt alone and lonely and lost since, over the last month, or a couple of months actually, when I've been going through this and kind of fearing what could be going on. Cancer, is this what is going on? Because this isn't right. And I know, again, that when you're going through something like this, you think that you're the only person experiencing this in the world. And I'm not. I am not the only 45-year-old going on 46 who does not have children, who always had that dream, and now that dream has changed. And what motherhood, like for them is very different than what they had imagined for themselves moving forward. So I know that. I know I'm not the only 45-year-old going on 46-year-old who has started to question everything that they've done in their life up until this point. Relationships, decisions on going back to school and, chase a career, decisions about, family planning a priority. I know that I'm not alone in that. And so I'm hoping that this video will reach someone who is experiencing this, and you're feeling alone, but girl, I am right there walking it in it with you. So that's my story, and I'm going to try and upload more and share more as I go through this journey and this experience and making decisions. And yeah, thanks for watching. Comment, like, subscribe, share. I don't know. What do YouTubers say? I hope you guys have enjoyed this very long and detailed story time. But thank you for watching, and I'll see you guys in the next one.